I mean, I think that's a big question that we're trying to work on, is how do these vascular changes potentially lead to neurodegenerative changes? And, while stroke will cause, tissue loss and tissue damage, we know that the risk of dementia is increased with stroke, and not just vascular dementia, but also Alzheimer's dementia. And so I think that's an open question. And, I think there's a lot of work going into preclinical models and how the effects of stroke and possibly neuroinflammatory effects may lead to neurodegenerative processes, more than just the damage that occurred at the site of the stroke. We know that, so it could be that the stroke itself triggers something else. It could be that the neurodegenerative process was there all along and the stroke unmasked it. But, there is some evidence that the risk factors that lead up to strokes, or the vascular risk factors, also increase the risk for neurodegenerative disease, even without having an overt clinical stroke. And so, there's certainly a lot of overlap between vascular health and these vascular processes and neurodegenerative disease. And, I think certainly we know that identifying vascular biomarkers will help select the patients in order to test these treatments as well. And selecting those patients specifically that may be at greater risk for cognitive decline, then we'll be able to have studies where you don't need as many people in order to show a treatment effect, whatever treatments could be, whether it's trying to show more definitive benefit of intensive blood pressure lowering, or there's still an open question about antiplatelet treatment for people with subclinical small vessel disease finds. But my focus is really more in identifying the biomarkers that are going to help us connect these vascular risk factors to neurodegenerative disease, so that we can select, the patients that are going to benefit the most from treatments.